National Physical Activity Plan. The U.S. National Physical Activity Plan is an excellent example of a partnership with the goal of increasing physical activity for the sake of public health. Although the research indicating the health consequences of physical inactivity is substantial and growing, no unified approach to improving the physical activity levels of Americans was attempted before 2008. The long-term goal of the U.S. National Physical Activity Plan is to create a social movement that dramatically increases the level of physical activity participation throughout the country. What is the long-term goal of the partnership? The long-term goal of the U.S. National Physical Activity Plan is to create a social movement that dramatically increases the level of physical activity participation throughout the country. Can the lessons learned from the anti-smoking campaigns be applied to physical activity advocacy? Answers may vary but include the following. 1. A small group of dedicated, persistent, media-savvy, and politically astute leaders and agitators can have a significant effect on public policy. 2. Broad-based support and well-networked coalitions are needed. 3. Commitment to a comprehensive package is crucial in this case, a 10-point plan. 4. Interventions known to be effective must be fully implemented. 5. The issue of individual versus environmental action must be addressed early, often, and well. 6. Acknowledging the evidence of harm is necessary but not sufficient for policy change. 7. Decades of effort may be required. What is physical activity advocacy? Advocacy for health is a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and system support for a particular health goal or program. Chilton 2006 also noted, the key goal of physical activity advocacy is not individual behavioral change, but achieving advances in political commitment, policy support, infrastructure, funding, and systems changes. What are 5 imperatives for successful physical activity advocacy? 1. Establish the urgency through growth and translation of science base. 2. Creatively communicate the urgency to people who can make a difference. 3. Develop and provide evidence-based feasible solutions. 4. Mobilize a strategy. 5. Maintain creative persuasive communication tactics that keep an issue prominent in the media. What is the Toronto Charter for Physical Activity, and how can physical activity practitioners use it? The Toronto Charter, published in 2010, is a call for more political and social commitment on the national level to support health-enhancing physical activity. It advocates the following 4 actions. 1. Implementing a national plan for physical activity promotion. 2. Introducing policies that support physical activity. 3. Reorienting services and funding to make physical activity a priority in education, transportation, and planning, the built environment, worksites, sports, parks, and recreation, and healthcare. 4. Developing effective partnerships for action. The Toronto Charter asserts that physical inactivity is a global problem and must be addressed throughout society. Physical activity practitioners can use the Toronto Charter as a global example of the need for physical activity interventions in communities and as a template for initiating change locally. The next module focuses on working with communities to promote physical activity. Here are the overview of this module. They are why work with community-based organizations. What types of community-based organizations might be good partners for physical activity? we will cover a bit, and I will elaborate in the classroom. Community organizations are always engaged in activities that promote the well-being of a community. Most community organizations aim to identify problems relevant to their clients and community, discover what contributes to those problems, deliver relevant and cost-effective programs, evaluate their programs, and seek additional funding to sustain or expand these programs. Therefore, we need to know the appeal of community organizations. That is, we should often know community needs and interests, often know how to reach people, and have potential to reach more diverse populations. In addition, we seek the way to embed programs into existing programs and events. What does it mean to work with the community? In general, there are two types of collaborations, namely community-placed collaboration and community-based collaboration. A distinction can be made between community-based prevention and community-placed prevention, or community interventions versus interventions in communities. Although both take a population-based approach, community-based activity involves members of the affected community in the planning, development, implementation, and evaluation of programs and strategies. An example of this type of prevention effort is community-based participatory research, in which academic researchers are usually in control of the decisions on the research question, design, methods, and interpretation of results. Invite or concede at least an equal partner role to community members in formulating, conducting, and interpreting the research. It is important to note that rarely are all members of a community involved, and that for those who are, the level of involvement can vary tremendously. Community-placed activities, on the other hand, are developed without the participation of members of the affected community at important stages of the project. While the program may be centrally planned, effort is expended to generate community support. An example of the community-placed approach is the YMCA Diabetes Prevention Program that is being implemented in partnership with YMCAs across the country, some with more tailoring to the localities than others. Although there are distinct differences between these two approaches to prevention, for purposes of this report, key domains for valuing are common to both approaches. Therefore, the term community-based prevention is used to encompass both community-placed and community-based prevention programs, policies, and strategies. Community-based program design is a social program design method that enables social service providers, organizers, designers, and evaluators to serve specific communities in their own environment. This program design approach depends on the participatory approach of community development, often associated with community-based social work, and is often employed by community organizations. A fundamental characteristic of community-based programs is that staff and families work together in relationships based on equality and respect. Programs make every effort to affirm and strengthen families' cultural and racial identities and their ability to function in a multicultural society. Programs work with families to mobilize formal and informal resources to support family development, and advocate with families for services and systems that are fair, responsive, and accountable to the families served. Challenges exist when collaborating with the communities. For example, we need to think some questions as below. Do our interventions work in community settings? Are our interventions even feasible/appropriate/desired in community settings? How well do our interventions translate to the community and ultimately get disseminated? Some challenges of community-based program design are the limited availability of resources, propensity for high levels of staff turnover, the reliance upon unpaid volunteers, participant retention, and the evaluation of a dynamic task environment. Point 3. For the same reasons that sustainability is an advantage of this approach, utilizing limited available resources is a challenge. Based on free market principles and resource scarcity, programs often operate below Pareto efficiency. Limited resources result in high levels of staff turnover and reliance upon unpaid volunteers. Low availability of limited resources is also associated with low levels of participant retention.